Welcome to the Howell Business Beat, where we delve deep into the dynamic world of entrepreneurship, innovation, local happenings, and success stories, bringing you the latest insights, updates, and strategies to thrive in today's competitive business landscape. Join us as we interview today our industry leaders and CEOs. Today's guest is John O'Malley, president of Trinity Health Livingston. I'm also joined today by our co-host, Dianne Samples.
Hello.
And we're excited for a update about what's going on in Livingston County, and it's always wonderful to hear from John. So welcome, John. Thank you for joining us today.
Thank you, Janelle. I'm happy to be here, and it's always a pleasure.
So I know we were talking a little bit before the show started. And as loaded as a question as it may be, I'm going to ask you, before we get into that heaviness, tell us a little bit about yourself, how you came to Livingston County.
Oh my God. This is, I think, my fourth decade in healthcare. So one of the things I've always enjoyed about being a leader in healthcare is the interaction not only with the community but with the staff and the physicians. I think it all happens right here in a community hospital, and I enjoy that interaction much more than say at the corporate offices. So I have, I've gone from environmental services as an employee all the way up to being COO and running some very large tertiary and one academic medical center in Philly, and then decided to come back to Howell. I had an opportunity, 8-9 years ago. It was Trinity Health was struggling a little bit with what they were going to do with Livingston County, and I was offered an opportunity to come in and really take a look at the community, take a look at the county and surrounding areas, and with the help and partnership of IHA, we put a strategic plan in place to really, grow this community and hopefully at that time end up doing well enough to warrant building a new facility that would serve the community for decades into the future. So that really appeals to me. This is like the third time I think I've been involved in this type of a project. So that appeals to me much more than the senior level, positions. I was intrigued by it and wanted to come to, Livingston County, quite frankly, because it's a great community. It's very focused on families, and that's something that I enjoy. So, that's why I came here.
Well, glad you did.
Yeah. And what an incredible asset for us as a community to have somebody that has that type of compassion and excitement for healthcare and services and family. And not only that, but your wealth of knowledge and experience that you're bringing to our community. We're really grateful for that as well. So thank you for being here.
It's been fun, Janelle. It really has.
Oh, good. I'm glad you can say that.
Well, the third time's a charm, too. So we're excited, too. We're excited for great things on the horizon.
Yes. And so with that being said, I know you mentioned a strategic plan, opportunities for growth and expansion. What does that look like for Livingston? I know there's been a lot of exciting developments, even a groundbreaking recently. So I hope you can share a little bit more on that today.
Yeah, I'll kind of start at the beginning so you sort of get a flavor for our journey and what we've been doing, the last eight or so years. We recognized about 8 years ago that we really needed to bring a lot more primary care physicians into Livingston County. We just didn't have enough here. So working collaboratively with IHA, we opened up numerous primary care, urgent care, and now specialty care through the IHA medical group. We have a site in Howell, we have East Brighton, we have South Lyon, Hamburg, Pinckney. So we've added all those sites. And what that did was that gave us a nice base for primary care. And if you think about it, primary care refers patients to specialty care and subspecialty care. So what that allowed us to do then was, once we built that base, now we're bringing specialty care and subspecialty care into the community to serve the community locally. So local care local. I know you've probably heard that ad nauseum, but it is something that we really believe in here. And so, not only did we expand general medicine, but we expanded our gynecological surgery. We expanded urology and cardiology and intensive cardiac rehab and orthopedics and minimally invasive general surgery and bariatric surgery, as well as oncology. So a lot has really happened in the last 8 years that has gone towards serving this community and the needs of this community here locally, and that will continue with the new hospital. We did get approval for in December for replacing the hospital located in Howell. The new hospital will be located on the campus of the Trinity Health Medical Center, Brighton. It's actually going to be located behind and attached to Trinity Health Medical Center, Brighton. So, it's something that it's a campus that I think provides the community the ability for us to continue to grow over the next 5, 6, 7 decades, and really, really service this community nicely, in that respect. So, a lot going on right now. Because of all those changes and spending all that money to try to serve the community, we are really, really busy. We at the hospital currently run pretty much full almost every day. Our surgeries have really gone up nicely. Our safety and our quality care, our outcomes, I'd put up against anyone relative to the type of services we're providing. Certainly, Janelle, we're never going to be an open heart surgery center. We're never going to be a major tertiary medical center. That just doesn't make sense. We're in a 193,000 person community. So really focusing more on full service community hospital services, both from a medicine and surgical perspective, is really where we need to be. And if anyone needs those higher tertiary or quaternary services, we're here to safely get you into those services wherever they may be. And so that's really our goal, is to try to provide that high quality, great outcome care, and do it in a safe environment.
Absolutely. And I think that's key, making sure that that environment is safe. And it sounds like you've got a good plan in place for that. I find it fascinating that what you've been able to accomplish and do in the past 8 years, given the fact that we also navigated a incredibly challenging time through the pandemic. So I was wondering if you could maybe talk a little bit about how you were able to achieve that. And, was there anything that you feel that Trinity Health did that kind of set you apart and set you on that great trajectory for that growth and to continue to be where you're at today? I mean, that's pretty remarkable.
Yeah, I think that the pandemic definitely threw us all a curveball, I think. And it was something that I think we were successful being able to care for the community, because we had great partnerships with our Livingston County Health Department and many others. It's kind of interesting. I was talking once to some of the legislators, and they're like, "Boy, we go around the state, and you have just such a remarkable relationship with your health department," which apparently that's not quite common. But we did. We had and I think that helped a lot. We worked collaboratively during the pandemic to really work together to care for this community. Coming out of the pandemic, though, that was really hard on a lot of our caregivers. And I think because of it, we've seen, a lot of retirements in nursing. and other disciplines. And so it's made for somewhat of a little bit of a challenging environment for us from a staffing perspective. We actually have our own what we call first choice, which are nurses that have the ability to kind of go here, there, and everywhere. And we do utilize those nurses currently as we continue to recruit and fill for some of those positions due to those retirements. But the pandemic was tough. That was not easy for us. But I think the success was the community, the health department, the hospital, our medical center in Brighton. We all pulled together as a community and worked together, and I think communicated together. So everyone knew what we needed, what we may have been running short of from a personal protective perspective, and and pitched in. And so as much as, we really tried to offer as much as we possibly could to serve the community, I think the community helped us out in a big way as well, so that we could serve them appropriately. So, yeah.
It's interesting. I think that's, again, fascinating that you're able to have that collaborative relationship and have those open lines of communication. I think that really benefits everybody. And you touched on it a little bit because I'm going to ask you a little bit about some may say that we're potentially in a healthcare crisis, and as far as it relates to staffing. And what are you anticipating, and how is Trinity Health preparing for that?
Yeah, it's a great question. We, are we in a crisis right now? And I don't know what other, systems or hospitals are dealing with. I wouldn't say we're in a crisis right here. We're very well staffed here at our hospital.
That's reassuring.
Hospital. Pardon me?
I said that's reassuring.
No, we are. We're very well staffed here. We trust me. We've got our arms around the pulse of all of this, and I look at it. It's really about the relationship we have with our staff, with our leaders. We work together. I don't sit in some ivory tower. I'm out and about talking to staff and talking to leaders. We try to understand their needs as well, so that we can, address their needs and hopefully, they recognize that and stay with us and work with us to care for this community. So, and I think that's working right now here. I don't know. I hear some horror stories, from organizations around the country, and I don't know what their particular situations are. I think it in the future, we're going to have to change our model a bit. I do think we're going to have to provide our BSN nurses with a lot more support, be it LPNs or nurse techs or whatever it might be. I also think virtual nursing, so having a nurse that can actually look into the patient room and interact with patients and families via telemedicine is something that we're going to have to do more of, and that'll definitely help. The nurses on the medical surgical nursing units. So I think the model's got to change. I think what makes up the persons that take care of those patients is going to change. And I think you're going to find the nurse is going to get a lot more support in helping to care for those patients. I don't think we can continue down the road that we've always done the last, 20 years. It definitely has to change. And we are actually, the new hospital is going to have it's going to address a lot of these type of issues. The new hospital is going to have that capability where we're going to have actual live nurses that are going to be able to get into the room, whether it's on the television screen or a screen right near the bed, and interact with patients and families, as well as caregivers that are going to be on site.
You brought up a good point as far as what are you anticipating your staffing needs? How is that going to increase with the new facility being built?
Yeah, we're actually, our staffing needs are going to have to increase. Our volumes, just our sheer volumes, are going to drive our staffing up. But the other thing we're doing is we're working very closely with a lot of colleges and universities to see how we can expand those programs, whether it's the radiological tech program or an LPN program or a BSN nursing program. We're working with a whole host of locally colleges and universities, and trying to see how we can really bolster those folks. And actually, the really cool thing is we're also going into the high school saying, hey, look, if you go down this path, we'll pay for it. We'll pay your entire education. And all we're asking for is, it varies, but 2 or 3 years after you graduate, you work for us somewhere. I mean, whether it's here in Livingston County or in Livonia or in Ann Arbor or wherever. But I mean, you work for us for 2 or 3 years, and so not a bad deal. It's actually
that's an incredible incentive.
Yeah, it's a very nice deal. So we're doing a lot of things around that to make sure that we have the staffing at our facilities to care for the needs of the community far into the future. So, and we're also, honestly, recruiting. We're recruiting not just here in Michigan, but throughout the country. Trinity Health is a national healthcare organization, faith-based Catholic healthcare organization, and we've even looked to bring nurses in from out of the country. So there's a lot going on around all of this, because we know we've got to care for our communities today and well into the future. So even though I don't have really an issue right now, it's not to say I may not have something in the future, but I think if I do, we're positioned nicely and ready to deal with it.
Like you said, it sounds like you have a good pulse on it and are ready to act and have a plan for if that happens.
It's a good proactive approach.
It is, very much.
So when is the anticipated completion for the hospital?
Well, the hospital will be completed the end of 25 calendar year. And we're trying to improve upon that date. We are as I'm sure you and everyone on the podcast, inflation and material or supply costs have hit everybody. That's no different in our construction process. We have been very diligent on bidding everything out and trying to get our material costs down and inflation down as much as we can. But right now, it's a struggle. It's a struggle to stay on budget. And so we're doing everything we can to keep that budget within what we indicated it would be, and then we're also trying to improve upon a timeline. Timeline has slipped a bit. I need time to train nurses in a new facility, to train overall staff, rad techs and everyone in a new facility, to let them become familiar with it before I transfer patient one over and we open the doors. And so we're looking right now at March of 26, seeing our first patient. I'm hoping that's going to improve. And certainly we'll keep the community apprised of when, the opening will be. But we're really focusing on transferring the patients we have here, and then, of course, seeing our first admitted patient non-transfer in March of 26.
Well, it sounds like it's going to be a lot of fun, and time flies when you're having fun. So it'll be here before you know it, John.
It will be here before you know it. It's amazing that we're already going to be into August and what we're looking at, because we're hoping to start steel in October. Wow, so the winter, we're going to put steel up this winter, and you'll start to see quite a few cranes behind Trinity Health Medical Center Brighton, as well as then come October or so, early November, maybe we'll begin to see some of the steel going up behind the roof of Trinity Health Medical Center Brighton. So, yeah, it's exciting. It's really exciting. But we've got some really cool. Oh, go ahead.
Oh, I'm sorry. Here's the $1 million question. Are you able to share what the plans are for the existing facility on Byron Road?
Yeah, no, that's a great question. And I'll tell you, we've only been working on that since about February. The whole project was approved in December by the board, so we couldn't work on it prior to then. It would be a little presumptuous to do so with the board not having approved the project. So we're working on a number of things. We certainly are not going to leave the site dilapidated or let it fall into disrepair. We are going to, we're evaluating a number of options right now to see if any of them make sense. And so I don't know what's going to happen with the site right now as I stand here. I could list off a whole bunch of stuff, but I don't know. I don't know if any of them are going to be what we're going to end up doing with the site. I know it's a big question out there. I can send this reassurance that this campus will not fall into disrepair. We will continue even if we're not here, and we haven't either sold the site or partnered with somebody on the site. We're definitely not going to let it fall into disrepair. So more to come. And I've all these podcasts I've been involved with and meetings in the community, I will definitely update everybody as soon as we have an idea of what makes the most sense for the site. It could be anything from, most everything gets torn down, turned into a greenfield site, and a developer buys it and builds homes. To perhaps we partner with an organization where, independent living or, homes for the aged or whatever ends up coming to the campus. So, so we'll see. We'll see.
It sounds
possibilities.
Like,
yeah.
It sounds like you're doing your due diligence to see what
Yeah,
is going to work best
absolutely.
for the
We
community.
definitely will do our due diligence and see what makes the most sense going forward. Some of this, you got to understand, some of this, I know it's easy for someone to say, well, just put behavioral medicine there or whatever. It's not
a lot of moving parts. Yeah.
In the state of Michigan here. So, it's easy to say. It's maybe in some respects, some of the services aren't so easy to bring to the community due to regulatory and other issues, CON laws and so
all
forth.
sorts of fun things.
Yeah.
Well, John, it's been a pleasure chatting with you today. I appreciate the insights that you've been able to share, and I feel really incredibly grateful that you're at the helm and you're really preparing Livingston County for everything that we need now and in the future. So as it relates to health anyways, and patient care. So thank you so much.
Yes,
thank you.
For
I've
joining
enjoyed
us.
it. If you need me on again, don't hesitate. I'm happy to do it. If you've got more questions.
We would definitely,
an update,
yes,
so.
we would love an update. It's just stay tuned for now.
Exactly.
Okay, I'm happy to come back on and more than happy to answer any questions you may have.
Awesome.
Well, thank you.
Thanks, John, and we appreciate everybody for listening. We'll see you on the next one.